When we think about heart disease and heart attacks, a lot of times we used to think of a middle-aged man clutching his chest. When he presents to the emergency room, he's urgently taken to the cath lab. We find a blocked artery. But we know that when women present the same way, even sometimes when you take them to the cath lab, there's still a high percentage that you might not find that blocked artery. And previously, these women were dismissed and told that they have anxiety, they have non-cardiac cause.
They're emotional.
Yes, they're emotional. But now we know that they still have heart disease. They still have ischemic heart disease, but it might be due to different pathologies. It could be due to microvascular disease, so a disease of the smaller vessels. It could be due to spasm. And in younger patients, as you mentioned, in the absence of traditional risk factors like hypertension, diabetes, they can sometimes have a classic heart attack, but when we take a look at the cardiac cath, we don't see a blockage due to a clot or a plaque, but rather a tear, which brings me to ask you to discuss spontaneous coronary artery dissection with us.
Fibromuscular dysplasia is a disease which predominantly occurs in women. It's a vascular disease, affects different vascular beds, more commonly in the kidneys or the blood vessels around the kidneys and the blood vessels in the neck area, but also could occur in the blood vessels around the heart. Now, when it occurs in the blood vessels around the heart, it could lead to what we call SCAD, which stands for spontaneous coronary artery dissection, which usually is a sudden onset, also occurs more commonly in women and would present like a heart attack kind of symptoms. Although those both disease entities, they remain rare worldwide, we still see a lot of cases every once in a while. Those patients, they don't really have the typical risk factors that you have just mentioned, like the high blood glucose and blood sugar and so on and so forth. However, those risk factors can still occur in this patient's population. One of the things that we do in this patients, if we did notice that they have any of those conditions, is early diagnosis, which means that if we did notice any abnormalities in any of their vascular beds, then this would definitely warrant those patients to have a complete scan.